All right, today we have a young patient who had an osteochondritis dissecans, which meant part of the knee cartilage has died. It's loose and floating around in his knee, so we're going to remove that and we're going to replace it with a piece of donor bone and cartilage. Getting ready to go in. We'll show you some photos of that. See you in a second.
This is the patient's x-ray looking from the side of the knee. Right above the kneecap here, you can see this large piece of bone and cartilage. We're going to remove that and then replace it on the end of the femur bone with the donor bone and cartilage. Here we are setting up the donor cartilage so that we can remove the plugs. During the surgery, we removed the large piece of bone which was floating loose in preparation for the implantation of the new plugs. For the plugs, we have a donor which is fresh with living cartilage cells to implant back into the donor. You can see here we have removed 2 of the plugs from the donor graft, which will then be implanted into the patient. This is what the donor plugs look like from the front view and from the side view. You see there's part of the thickness is cartilage and part of the thickness is bone. These will be implanted into the patient in the area where the cartilage was missing and that broken piece was removed.
All right, so we're all done with the surgery. We used 2 plugs from the donor, put them in the patient's knee. He should be on crutches for about 6 weeks, and after 6 weeks, he'll be walking normally. Expect him to be able to return to sports in 4 to 6 months.